Welcome to Life Transformation Radio. This show is all about life transformations and our journey from where we were to why we are doing what we are doing today. We will discuss the hiccups, the roller coasters, and the blood, sweat, and tears that has been poured out while discovering our purpose. It is all about our transformations. Here is your host, Sean Douglas.
Hey, good afternoon, good morning, good evening, wherever you're listening from. Welcome to another episode of Life Transformation Radio. I'm your host, Master Resilience Implementer, TEDx speaker, business positioning strategist, and international best-selling author, Sean Douglas. This show is currently heard in over 90 countries. So whether it's your first time joining us or you've been listening to us for some time, I want to thank you to those who are listening from around the world. Life Transformation Radio is all about our transformation. Here, we tell the stories of why we're doing what we're doing, highlighting those transformational moments that changed our lives, and how we use it to then transform others and elevate their lives as well. You can listen to us live right here on the Blog Talk Radio Network Tuesday through Friday, 5:30 p.m. Eastern Time. You can also join our Facebook group. Go search on Facebook for Life Transformation Radio Community. Join that group, interact with the fellow listeners and the guests that I bring on the show. Please subscribe, rate, and review on your favorite podcast platform. Life Transformation Radio can be heard on Apple Podcasts, Stitcher, Spreaker, Spotify, TuneIn, Player FM, Radio Public, Overcast, Himalaya app, Google Podcasts, and we're available on Pandora. We're also available on YouTube, so go ahead and subscribe to our channel at Life Transformation Radio right there on YouTube. On the show, my guests are entrepreneurs, speakers, business owners, coaches, podcasters, best-selling authors, amazing people who are impacting and elevating the world around them. And my guest today has done exactly that. If you have any questions for any of the guests that I bring on the show during our live broadcast, go ahead and give us a call at 657-383-1109. Again, the number 657-383-1109. Or go ahead and use our handy-dandy chat box, and you can type in your questions that will be asked live on the show. And with that, please help me welcome to the show my guest for today, best-selling author Danielle Roberts. Danielle, welcome to the show.
Thanks, Sean. I'm so glad to be here today.
I am excited as all get out for this episode because I've never had anything like this. So it's a little bit of a growth moment for me. I don't know what's going to happen, but I have a feeling that some people are going to get real educated today, and I'm excited.
That's incredible. I'm glad to be part of it.
I try to have topics on my show that really resonate with people. And it just so happens when we met, I was like, holy smokes, done deal, super yes, please come on my show. My mom has owned a home health care business in Michigan called Compass Home Health Care. In her first 2 years owning that company, she was ranked in the top 25 of all home health care businesses in Michigan. Her first 2 years.
Wow.
I was like, that's amazing. And then I heard about, I got to bill the health insurance, and then this hospital did this to us, and then this other company's doing this, and then the auditor. I mean, it's just like a whole host of things. I mean, this is people's lives we're talking about. And so when I heard about what your book was about and heard about things that you talk about, I'm like, oh, yeah, got to come on the show. I mean, this is going to be absolutely mind-blowing for people. So I'm just very, very thankful that you've come on the show.
Well, yeah, I think that's terrific. And, providers and Medicare beneficiaries alike are confused by this crazy Medicare stuff. So maybe we can help and clear some of that confusion up today.
Love it. Love it. The title of the episode is 10 Costly Medicare Mistakes You Can't Afford to Make, with best-selling author Danielle Roberts. She's a Medicare expert and the co-founder of Boomer Benefit, a licensed insurance agency that helps baby boomers navigate their entry into Medicare in 48 states. She is the author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make, which helps beneficiaries avoid critical but all too common Medicare pitfalls. Danielle is a member of the Forbes Finance Council and a past president of the Fort Worth chapter of the National Association of Health Underwriters. She now serves on the state board as its Medicare chairperson. She has appeared on more than 100 podcasts, radio stations, TV segments as a Medicare resource, and has over 600,000 followers on social media. The website, boomerbenefits.com. The Facebook, YouTube, and LinkedIn links are right there in the show notes. Go ahead and click on those. Subscribe to her channel. Send her a friend request on Facebook and LinkedIn, and let her know that you listened to this episode of Life Transformation Radio. Danielle, the first question that I have to ask, and I believe it is the most important question you could ever be asked, besides will you marry me, is why? Why do you do what you do?
So my why really is pretty easy, and I share this with our new staff whenever we're hiring on new employees at our agency here. And for me, it's that somewhere out there right now, probably in many cities across America, but I like to think of one person, there is a turning 65er, somebody that's looking forward to retirement, except that all their lives someone else has chosen their insurance benefits for them for health insurance, so they've never had to worry about that. It was provided by their employers. And now they are turning 65. Their mailbox is full of solicitations. The phone is ringing off the wall from telemarketers, and they are pulling their hair out, overwhelmed and confused, trying to figure out a beast of a national health insurance program like Medicare that has 4 parts, 10 supplements, and literally thousands of drug plan options across America. And that person is just at their wits' end. And so my why is I can reach that person and make all of that pain go away by providing just some very basic education on how your federal government benefits for Medicare work first and help you get that part down. And then once she has that part down, we can move on to all those solicitations and what they all mean so that those can be tossed in the trash, and I can have a confident person come out of that conversation or meeting or education session knowing what they need to do next and leaving all that overwhelm and confusion behind.
That is completely amazing, mostly because everything that you're talking about is something that I've had to face in the last 2 weeks. I believe in timing. I believe nothing happens by chance. Everything is meant to be. Everything. So I'm getting ready to retire from active duty military, and I've been on TRICARE Prime for 20 years. And my wife and I were sitting there, was like, what do we do? Like, we got to get a house. We got to, like, I mean, the big boy stuff. Like, we got that. And then it was like, what the hell are we going to do for like, medical insurance? What do we do? She's like, well, doesn't the military, like, I mean, you're a veteran. I'm like, I have no idea. So I had to ask. I'm like, hey, guys, people who retired, like, who do you have insurance? They're like, oh, yeah, TRICARE. Like you can just pay for it, and you can, you know, because it's paid, like your family's paid for in the military, active duty military. I had to ask around. I had no idea. I had to ask around. And it was something that I've never thought of for the last 20 years, and it became a huge realization because I've got 4 children under 17, and I mean, do I have to pay? Like, I mean, I hear, I don't know, premiums, you know, a couple thousand, couple, you know, hundreds or whatever. I'm like, do I have to add that into a budget? Like, it was something that I had to think about.
Yeah, and there's lots of other people out there that feel the same. They can totally relate to what that feels like because when they retire, they're losing their insurance as well. And it is confusing and overwhelming because, just like you said, your employer has always taken care of that for you and you've never had to worry about it. And there's a lot of misinformation and assumptions that exist out there, too, about what our benefits are going to be like when we retire. And unfortunately, most people don't have an opportunity to tackle that long before they're needing to make those decisions. And so I always wish that, the federal government would have a class for everyone when they're 50 and, teach them what they need to know so that they have time to prepare for all of that before they need it at 65. And probably likewise for you in the military and TRICARE, as you're getting ready to reach your retirement day, it would be great if there was just a webinar or a course or something you could go to that would ease that transition. And I think in a lot of places out there, we just don't know where to find those resources if they do exist or they don't exist at all. And that leaves us scrambling to take care of this on our own.
Mm-hmm. So I have a question that I have no idea. I mean, I could probably Google it, but since I got the expert here, what's the difference between like Medicare, Medicaid? I also know about like Blue Cross Blue Shield and like all these other ones, but so just quickly explain what the difference is between like Medicare, Medicaid. Is Blue Cross Blue Shield the same thing as Medicare, Medicaid? Because I don't know.
Sure. So Medicare is the health insurance that we provide to people age 65 and older here in America and to some younger people with certain disabilities. So if you're on Social Security disability for 2 years, you can qualify for Medicare after that point. You can also qualify for certain health conditions to get Medicare under 65, like end-stage renal disease or Lou Gehrig's disease. But most people think of it as our health insurance for seniors in the U.S. And Medicaid is a type of health insurance provided by the federal government for certain people with low incomes, and that can be for people of any age. So it is possible to have both Medicare and Medicaid if you were age 65 or older or on disability Medicare, and at the same time also being low income to qualify for Medicaid. And in that scenario, Medicare is your primary insurance and Medicaid is your secondary insurance.
Got it.
That's a lot just to absorb there because we have these two big M's, right? And then Blue Cross would just be an insurance company that would facilitate some of those benefits on a supplemental level. They contract with the government to offer plans in certain areas.
Okay, so like Blue Cross is like Progressive for your car insurance or Geico or like it's just another company.
Yes, that's right.
Got it. Totally understand. Yep. Awesome. Thank you for clearing that up because I had no idea. Like I said, I've been on TRICARE Prime, for 20 years. So, I never had to shop around for stuff like that. So, but other people, maybe they're college students, maybe they're graduating college and going into the business world and they just happen to, listen to this episode or maybe there's somebody who's 65 and getting ready to retire and go, I don't know. Right. So thank you for clearing that up. I really appreciate that. The show is about transformation, and I believe that we all go through a lot of transformations in life. But I'm curious about your transformation. What would you say is a transformational moment that happened to you, and it puts you on the path to what you're doing today?
Yeah, I have a great one for this because when you are an entrepreneur and you go out and you start a business, a lot of times in the beginning, you aren't thinking all the time about the spiritual aspect or what I call the warm, fuzzy aspect of a career. And most of us, we want to have a career that we find fulfilling. But we also, in the beginning of starting a business, you're often focused on how little you have, how you're eating macaroni to make ends meet, and you're getting that business off the ground, and it can be a lot financial. And when I decided to start my own business, I was looking for something that I could do that would be a lucrative career where I could, make a great living and maybe someday provide jobs for other people. But I also wanted it to be something that I would feel good about when I would go home and go to bed at night. I wanted to feel like I helped someone with whatever business that I started. And so the reason I was attracted to health insurance is you don't have to have any products on the shelf that are going to spoil. It's a business that you can start out of an office in your home. It's relatively inexpensive to get started with, but you are going to help explain a confusing product to people. And so when I was beginning to do this, I worked a lot with group and individual health insurance back in 2005. And what happened is I started working with business owners, probably people kind of like your age, Sean, who had questions about their insurance, and we would help them get set up on their own insurance products. And then something that started to happen was I would get calls back from those business owners sometime later, and they would ask about their parents. And they would say, hey, I thought my insurance was confusing when you helped me set it up, but wow, my mom is turning 65 and this stuff is really confusing. Like I can't make heads or tails of it. And it happened enough times, probably 4 or 5 different people asking like that before my business partner, who is also my brother, and I said, hey, we should look into this and see what it's all about. And we did look into it, and we found that Medicare certainly was even more confusing than insurance for people that are under 65. And so it seemed like a great path. Let's bring Medicare into the future. Things are starting to go digital online. Eventually, people aren't going to be buying this over the kitchen table anymore. They're going to want to buy it just like they buy their car insurance, where they shop online. And some of the other insurance agents that had been in the business longer than me at that point kind of laughed me out of the room and said, seniors don't use the internet. They don't like anything but a kitchen table sale. They'll never trust you. And that really resonated with me because I thought that was totally false. I thought it was something that absolutely people could understand and they could go through it. And so I think the really cool part about it for me was I came out of a meeting one day, and it was a kitchen table meeting, and I had 4 or 5 messages on my cell phone from other clients that I had helped in the past that needed help. And that's when my moment dawned on me that, hey, this isn't just a one-time sale. Like, you got to have customer service on the back end, and I need to build a team that's going to be able to help people when Medicare denies their claim. What do they do? Or what if they're standing at the pharmacy counter at 4 o'clock on a Friday and they're being told their insurance won't fill their medication and they're going to have to go all weekend without their diabetes medicines? And that's kind of where the foundation of Boomer Benefits grew into what we have today, which is not just helping them pick out their coverage in the beginning, but being there on the back end for all of the hiccups and hassles that just are ordinary things that happen with the federal health insurance program.
God, okay. I like it. I like that. I like how that evolved. Started out, and then it just kind of evolved from there. I like it.
Yeah, and then today we spend over $1 million a year in payroll for a team that doesn't bring in any new business. They just support our existing policyholders, and the love that you get back from people on that is just amazing. They tell their friends about it. They leave you beautiful reviews online. They send messages on Facebook, and almost every day I get something from someone who's just so grateful for the help we provided, and it just never stops making my day.
Holy smokes. Like, I'm trying to wrap my head around what you just said. Because, I do payroll, I'm not $1 million. $1 million in payroll. But if you would have said, oh, we do $1 million in payroll, every year, whatever. I'm like, wow, that's an amazing business. And then followed that up with, and no new clients. I'm like, wait a minute. like my heart started pounding when you said, oh yeah, and no new clients. You know what? I'm like, wait, what? And like my heart started pounding because immediately I'm like, how do you make payroll? So I'm fascinated. I'm fascinated that that you've accomplished that. Wow. I applaud you because I know how. I've had 4 businesses, and I know how hard it is sometimes to even make $30,000 in payroll, $50,000 in payroll. And I ran a company that we were doing $650,000 in revenue and it was like, oh, 100,000 in payroll. I'm like, okay, we can make it. We had all this overhead, tons of overhead. We were hemorrhaging overhead, and yeah, wow, that's awesome. You rock. Better than me.
Thank you. It's great to be able to attract new business with one team and then just solidify and serve that business, those people with another team, and know that, hey, those people are going to sleep good tonight because we just took care of a billing issue that they've been trying to figure out for the last couple of months on their own, or if they remembered to just call us when something happens, they never even have to deal with it on their own. They're not calling Medicare or a call center at an insurance company trying to figure out what went wrong. They just reach out to the team here, and we already know how to handle all those things. And I love that it takes the stress off of them, that they don't have to be worried. When a bill shows up in the mailbox and you're living on a fixed income, that is a very stressful event for some people. And we want them to, before they panic, just call Boomer Benefits, let our team take a look. A lot of times the doctor coded something wrong or Medicare never got the bill. And I have one time where a new client walked into our office and he was literally in tears. He had just gotten out of the hospital and he got a bill. It was for over $100,000. And he was like handing it to me, and he's like, I don't understand what happened. What happened? I bought this insurance. And I was like, okay, sit down. You don't owe this bill. This is just the hospital flinging out a bill before Medicare's having even one day to pay. But just sit here. We're going to call Medicare on a conference call, and I'm going to show you right now that you're not going to go owe anything. And I loved being able to give him that relief and help him know that in the future, when other things like that happened, he didn't have to panic. He could just reach out to us, and we'd put him on a product that really was going to take care of all those things so that he could focus on healing if he's in the hospital or just coming out of the hospital, and not worrying about, oh, my gosh, what am I going to do with this bill?
Oh, for sure. I remember when our bill for Duke Hospital, our 3-year-old, so she was diagnosed with newborn hemolytic anemia, which means that my wife's KELL, that's K-E-L-L, the KELL elevation was really high, which tells them that there's something going on. There's something like really wrong or something. I don't know. Something's going like really wrong. So we go to Duke, and they said, yeah, so what's happening is your blood is trying to kill the baby. There's some kind of a protein.
Oh, my goodness.
So they took my blood, they took my wife's blood and everything. And the bill for 5 intrauterine blood transfusions, like they stick a needle through the umbilical cord and pump blood out of a machine into the umbilical cord into the baby, was well over $100,000. Well
Whoa.
over. And then you had like hospital visits and we were going every Thursday and Friday for an ultrasound, measuring the blood flow of the baby, measuring, time to go. We got to get a transfusion. It's the week we do a transfusion. Crap. Okay. But we had to go every single week. And all of that, it was well over $100,000. And we were looking at this thing from TRICARE and was like, man, how awesome is our insurance? Like, you almost feel bad, like kind of feel guilty. We got some pretty decent insurance, but I looked at it, was like, there's no, like, I can't even imagine what would happen if we didn't have insurance, or we had an insurance that just didn't cover even half of that.
Yeah, it would be very stressful, wouldn't it? And there's lots of people out there in that situation all across America every day.
I can't even imagine. I can't even imagine what that's like. But thankfully, you have written a book called The 10 Costly Medicare Mistakes You Can't Afford to Make, which, where is it available? So I'm assuming it's probably on boomerbenefits.com. Is it on Amazon? Like, where could somebody right now go and buy this book?
Yeah, so you can find the book on Amazon. You can find it on Barnes & Noble. There's a print and Kindle version available. And we also have a website, so if you want to read a little more about what the book's about before you purchase, you can go to 10medicaremistakes.com. That's 10 with a T-E-N. and 10medicaremistakes.com. There's a short video there and some additional details about the book as well.
Love it. Very, very cool. I know that's going to definitely help some people for sure. So let's talk about that. Let's talk about your book and what those costly Medicare mistakes are.
Okay. So when I started thinking about writing the book, it was in a conversation that I had with our client service team manager, and that's the team that helps our existing clients. And we realized that across America, every day, new Medicare beneficiaries who often don't know what they're supposed to do make the same mistakes over and over again. And so we were talking about, there's plenty of books out there about Medicare that explain the basics, but what people are feeling stressed about when they're getting ready to turn 65 is the mistakes they might make. And so we sat down and hammered out, what are the mistakes that we see most often? And then we polled our Facebook crowd and asked them, tell us the mistakes that you made when you didn't know any better. And we got this great feedback. And so we set out to put a book together that hopefully someone might pick up when they are, 64 or younger, and learn a little bit about what to expect from Medicare and be able to avoid the mistakes. And so the first mistake seems kind of obvious, but it's not at all. We have lots of people that reported to us that they didn't know this, and we've experienced it ourselves, which is that Medicare isn't free. And so when you're working your whole lifetime and you see on your paycheck, your pay stub that you get every other week or whenever you get your paycheck, that there's these FICA taxes being pulled out of your check to go toward Medicare and Social Security, you assume that when you get on Medicare that you've already paid for that, right? Because otherwise, what have you been paying for all these working years? And
Right.
You're half right. You're half right. And Medicare Part A, which is your hospital insurance, that is paid up. So when you turn 65, if you've worked at least 10 years in your lifetime in America or are married to someone who did, you will not have to pay for your hospital insurance, and that's what those taxes went for. But those taxes do not pay anything toward Part B, which is your outpatient coverage. And you and I might think of that as doctor visits and lab work, and do we really need that? I mean, that can't be that expensive.
Pharmacy.
Well, yeah, Part B pays for, that's right, some drugs that you might get on an infusion basis, like chemotherapy, falls under Part B. Outpatient surgery, that falls under Part B. And in 2020, Part B cost $144.60 a month, which is approximately 10% of the average Social Security check. And that's before you buy Part D drug coverage or supplemental coverage or dental, vision, and hearing coverage. And so the first mistake in the book is just that people assume Medicare is free, and they often find that out too late. And sometimes we've had people here in our agency over the years where they've come and learned this and said, you know what, I'm not going to retire. I mean, I need to work for a few more years because I didn't anticipate paying for this. And so we want to get the message out that, Medicare isn't free, and you need to be looking at this with your financial planner many years before you get ready to retire. So that's mistake number one.
Awesome.
Yeah. So mistake number one, hopefully some of you knew that already, but number two is expecting Medicare to cover 100% of your health care costs. And if you think about this, we really shouldn't expect that, because when you have health insurance under age 65 through an employer or through the Affordable Care Act, you usually have a copay when you go to the doctor. There's a deductible you pay when you go in the hospital. That's called your cost sharing. And Medicare is the same. So if you go in the hospital, you have in 2020 a $1,408 deductible that you pay for that hospital stay. And if you need outpatient coverage, the first outpatient visit of the year, you have a much smaller annual deductible. It's around $200. And you're going to pay that out of pocket before your Medicare pays anything. And then Medicare only pays 80%, and you pay the other 20% forever with no end, no cap. And just imagine that if you had 8 weeks of radiation or chemotherapy or dialysis, how huge that bill would be. So you need to know not only that Medicare isn't free, but then when you get there, even though you're paying a premium, you're also going to pay things as you go and use those services, which is why, of course, supplemental insurance was created in the first place, which are the types of products that brokers like Boomer Benefits offer. But first, we educate people on stuff like this, like, okay, here's what Medicare covers, but here's what it doesn't. And that way they can get a good handle on maybe what they need to expect going forward. Are you with me so far?
Got it. Tracking. Yep.
Okay. So moving on to mistake number 3, which is chapter number 3 in the book, is missing your initial enrollment period. Did you know that you are responsible for knowing when to enroll in Medicare? And they're not going to mail you anything? Yeah, and most people don't. Yeah. And so if you weren't working with the financial planner or someone that told you this ahead of time, you could miss your initial enrollment period, which happens when you're turning 65. And so it's actually specific to you and to your birthday. So 3 months before you turn 65, your initial enrollment period starts, and it lasts all the way through your birth month and out 3 months out the other side. So you have a 7-month window to sign up for Medicare, Parts A and B, when you are turning 65. And if you don't have other creditable coverage, such as still working and you have employer insurance from a large company, something along those lines, and you miss that initial enrollment period, later when you figure that out, you have to wait until the next general enrollment period, which starts in January each year, to go and enroll, and they're going to tack on a 10% penalty for every 12 months that you should have been enrolled that you weren't. So you might have insult to injury when you don't sign up for Medicare because you didn't know you needed to, and then a few years down the road when you figure this out, now you're going to pay a penalty on top of all the premiums that you have to pay that we learned about in mistakes number 1 and 2. So it's really important for people to know that unless they're still working for a large employer with 20 or more employees when they turn 65, they need to go to Social Security website or down to their local office and apply for Medicare and get it in force. They are responsible for doing that.
Did not know that.
Well, you would be like many other people because there isn't anything that comes in the mail. And there's actually some legislation being proposed in Congress right now to fix that, to where there would be a notice from the federal government. And I think that's very necessary.
Oh, good. Okay. Yeah. I mean, I feel like they should. It's almost like a deterrent, like, just don't tell nobody, we won't have to pay nothing. Like, you know, like if they don't know about it, that's their fault. Like it's almost literally like, I don't know. It just seems like if they cared about helping people, serving people, insuring people, whatever, they would want to reach out to those who are, which is almost probably an impossible task, by the way, you know, to know who is turning 65. However, at the same time, you know, there's got to be something your employer should tell you, like something somewhere. I mean, the education, I think, is lacking. It is. It's lacking.
Yeah, so, like, just give a little help, you know. I mean, we wish that message would get out there, and it just doesn't. There's surprisingly lots of people out there who are very healthy at age 65, and if they work for a small employer and they didn't know that they need to sign up if their employer is a small employer, or if they're retired but they're just really healthy and they think, you know, I'm fine, I'll just wait for that annual election period that comes around in the fall and I'll sign up then. Well, it doesn't work like that. And so usually the time they figure that out is when a health condition now has developed, and they go to try to sign up and they're told by Medicare, nope, sorry, you have to wait until January. Well, imagine if you got sick in February and you couldn't enroll until the following January. And then when you did enroll in January, the benefits don't start till the following July. You could literally be running around without health coverage for well over a year if you timed that just perfectly and unluckily.
Why so long? Like, why? Like, when I sign up, how do I not have coverage like that day?
Well, when you sign up, you will have your coverage. If you apply in the first 3 months before your 65th birthday, the coverage will start on the first of your month of your turning 65. But if you miss that, and you don't realize it, and you'd be surprised how many people this happens to. They're healthy and they don't think about it, and they just never enroll. And then, a year or two later, when something starts to go wrong and they need to see a doctor, they're trying to enroll and they find out, wow, they missed their window and they've got to wait until the annual window, and that could be months and months away. So that's why we made it number 3 in the book, because people really need to do their research about this stuff ahead of time and make sure that they know when to enroll so they don't get stuck with a penalty or stuck with a period of time without coverage.
Mm-hmm. But if you sign up let's say you signed up in January because you missed it, why, you said until the next July, why does it wait?
Yeah, that's a good question. They should be able to just have that coverage start immediately, but they don't. The rule that Social Security set is that you have to wait until July. And we don't really know the reason, but it almost feels like kind of a penalty. In addition to the financial penalty, they want it to be painful enough that hopefully people won't miss the initial enrollment period. And it's just sad the way it affects people sometimes.
Crazy. Awesome. Okay, number 4?
Yeah, number 4 is skipping the prescription coverage. So for over 40 years, people on Medicare had no outpatient drug coverage. None. I had clients in 2005 spending thousands of dollars a year on their outpatient drug coverage for diabetes, things like that. So fortunately, the modern Medicare Modernization Act was passed in 2003, and Part D was created in 2006. And this is voluntary prescription coverage that you can sign up for to help you with the cost of your outpatient prescriptions. And even though it's voluntary, if you skip it, there are some bad things that can happen. Number 1, if you skip the drug coverage and you don't have any other creditable coverage, one form of creditable coverage would be VA benefits. If you get your drugs through the VA, you don't have to sign up for Medicare, and you won't have a penalty if you do sign up later. But if you don't have that creditable coverage, if you don't have the creditable coverage, then later you'll end up with a penalty that is 1% per month for every month that you waited. So if you waited 5 years and then you finally sign up for the drug coverage, you'll pay a 60% higher premium for the rest of your life on that coverage. So skipping and the enrollment into Part D is mistake number 4, because people sometimes don't realize it. They think, hey, I'm pretty healthy, I don't need any drugs right now. And then later when they do need them, they have the penalty. And the second part is that you don't know when you're going to get sick. And if you don't sign up for Part D when you're first eligible, you could get sick a few years later in the middle of the year, and you have to wait until the election period in the fall to join a drug plan, which won't start until January 1st. Well, some oral chemotherapy medicines these days are several $1,000s a month, and so we don't know when we're going to become ill, and you want to have that coverage in place for the unknown that might happen to you anytime in the middle of a year.
For sure. Yes, for sure. Wow.
So don't assume that you don't need drug coverage. Fortunately, in all the different states out there, there are some really inexpensive drug plans. In fact, in 2021, there's one plan that's a national plan that in some states is going to be around $7 a month. So even if you don't need drugs now, just sign up for the cheapest one so that you have the coverage if something happens. That way your doctor will have some medicines that he could prescribe to you, and also you won't have to worry about the penalty later on.
Isn't there like a community drug prescription or community insurance? I remember reading about this. It's like a community one.
There might be things like sharing ministries. Those are type of where you kind of pool together and people help pay each other's bills. So that is an option that you could look into to help you with that if you missed that window. But it wouldn't help you with the penalty when you later on need to buy into Part D. And it's not really true insurance. So you always want to be careful, too, to make sure that you have coverage that's really insurance.
I'm glad I mentioned that then.
I'm glad you did, too. It's a good point. Okay, so moving on to number 5. Number 5 is not keeping proof of your creditable coverage. So many people today work well past 65, and that's great. But when you retire, your insurance company is going to send you a letter in the mail, and it'll say, hey, you've been covered with this insurance company since such and such date. It's really important to keep that letter. Don't throw it out, and most people don't know that, and that's exactly what they do. They toss it out because they don't care. They're not on that insurance anymore. But later, when you go to sign up for Part D drug coverage, you may need to submit proof of that, showing the federal government, hey, I didn't have drug coverage when I turned 65 because I had this other coverage through my work because I was still working. If you don't have proof and they ask you to present proof, guess what happens? A penalty. You end up with a late penalty that you don't really owe. And so that's another important one, is making sure to keep proof of your insurance coverage that you had since you turned 65, so you don't end up in a situation where you owe a penalty for Part D late enrollment when actually you had work. And you'd be surprised how hard it is to get a hold of that prior insurance company and get them to send you a copy of it. It always takes weeks. They won't fax them. They always want to mail them. And so in the meantime, you're paying a penalty, and you don't want to be in that situation, of course.
Of course. Wow. That's a big one. Holy cow.
Yeah, not so much fun.
I'm seeing the theme.
Yeah, it is. It kind of fits in, doesn't it?
Oh, yeah.
Okay, so moving on to number 6. Medicare mistake number 6 is assuming that pre-existing conditions don't matter. So you may remember when Obamacare was passed, now people can buy individual insurance plans out in the private market, and they don't have to list any prior health conditions. They can get the coverage, and it doesn't matter. And that's really good, except that that doesn't apply to Medicare supplement products. So once you turn 65, that Affordable Care Act legislation doesn't affect you anymore, because when you sign up for Medicare, Medicare is your primary insurance, and you get that insurance with no pre-existing conditions. You don't have to worry about anything. But like we said, that only covers about 80% of your outpatient costs. So you may need to buy a Medicare supplement to help you cover your deductibles and that other 20%. And you have a very limited window to get a Medigap plan with no health questions. You have about 6 months from when you first activate your Medicare Part B to do that. And once that window passes, it's gone, and it's generally gone for most people forever in most states. And now later you try to buy something and you've got to answer health questions, and they can turn you down because it's supplemental coverage. It's optional coverage. And when you're buying a supplement to primary insurance, those types of insurance plans, you're not protected under those. Those are voluntary, and so they can turn you down. And so another thing we see happen, again, that healthy person turns 65, sign up for Medicare. Maybe they did them signing up for Medicare properly, but they didn't buy the Medigap plan. And they think, well, I'll just wait till I get sick, and then I'll sign up. And it doesn't work that way. And then sometimes they can't get the supplement coverage. So we put number 6 in there so that people know, hey, you need to know about this open enrollment window to get a Medicare supplement, because if you miss it, you might not be able to get one later on.
Wow. Again, I'm seeing a theme here.
Yeah, it's like a humdinger every time you turn around, and you just think, what? I can't believe this. And we just we see it from a lot of people, and so there's many things.
Yep. It's like a gotcha. Yeah. Awesome.
Yeah, and that's how they feel, right? They do feel like that. They think, wow, nobody told me this. I mean, and they're right, nobody did. And it's probably because there's 60 million people on Medicare and 10,000 new people aging in every day, and the federal government just can't afford to send them all a letter explaining every little thing, They used to mail the Medicare new handbooks out to people's homes. Now you have to print them online. They're not as readily available. They're not sent to everyone on Medicare that's new to Medicare. So it's just that you're right, another gotcha that can come out of the woods at you, and one that you want to be prepared for.
Yep, definitely. Cool. What's the next one?
Number 7 is canceling your Medicare Part B because you joined a Medicare Advantage plan. And so let me explain a little bit about what that is. When you sign up for Medicare, we talked about that Part A is your hospital insurance, Part B is your outpatient insurance, and that one costs money, $144.60 a month for Part B. It could be more than that if you're in a higher income bracket, but it's at least $144.60 for most people. Well, there's a type of plan that you can sign up for where you agree to get your Medicare benefits through a local private insurance company that delivers those benefits to you through a network, like a local HMO or a PPO. And those plans are very inexpensive. There are actually plans where you can sign up and you pay nothing for the plan because Medicare pays the plan to take on all your medical risk and have you be a member of that plan. And people sometimes think that when they sign up for that plan, they can cancel their Medicare Part B. And that is a huge mistake because you have to keep Part B. You have to have Part A and B in place. You have to keep paying for Part B, even if you sign up for one of those zero premium Medicare Advantage plans. And so what will happen is people, they don't understand that. And so as soon as they get signed up for the Medicare Advantage plan, they contact Social Security, they cancel their Part B, and they are immediately disenrolled from the new insurance plan that they signed up from because you have to have Part B to be in that plan. Now you really have a big problem on your hands because you've disenrolled from Part B, and you can only get into Medicare once a year during that annual general open enrollment period that we talked about in January. And once again, now we're waiting for those benefits to be put back in place, and it's not going to be in place until the following July. So just know that when you turn 65 and you get on Medicare and you sign up for Parts A and B, once you have them in place, you don't want to cancel them. So if you sign up for a Medigap plan, you still need A and B. If you sign up for a Medicare Advantage plan, you still need A and B. You should never, never cancel your Part B coverage once you sign up for that, unless you have gone back to work and you have employer coverage being provided. So
Perfect.
Big thing, very important, and super confusing, right? Because we have lots of moving parts around that one.
Right. Yep. Way good.
Mm-hmm. All right, and I know we're coming up on time here, so I'll kind of move through these last few rather quickly. Number 8 is the one we call the big mistake. And we talked a little bit about how when you first turn 65 and you activate your Medicare Part B, you have a 6-month window to sign up for any Medigap plan you want with no health questions asked. But people confuse that with the annual election period in the fall. And you might have noticed this, Sean, this time of year we have lots of Medicare commercials on TV. Every time you turn around, you're hearing them talk about it. You see Joe Namath, there's sports guys that hawk these plans on TV. And this is October 15th to December 7th every year. And that window is for changing your Medicare drug plan or Advantage plan. It's not for enrolling into a Medigap plan. And so you need to know the difference. You don't want to assume that you can sign up for a Medicare supplement in the open enrollment in the fall, and then you miss your one-time window to get into a plan, and now you have a health condition that doesn't let you apply for the plan that you want. So number 8 is just confusing the open enrollment periods. And this one, I have to say, it is kind of the federal government's fault, right? Because there's multiple periods that are called the open enrollment period. You have an open enrollment period for a Medigap plan. You have an initial enrollment period for Medicare. You have a general enrollment period in January for Parts A and B. And you have the fall open enrollment for Parts C and D. So if all of this has not completely confused you yet, then you are a rocket scientist, because just imagine that we have people turning 65 trying to learn all this stuff.
Yep.
Pretty confusing.
For sure.
Okay, number 9, you need to ask your doctor's office the questions, right? A lot of times by the time you turn 65, you have doctors that you've got great relationships with, and you probably don't want to change those doctors. And so before you get over onto Medicare, you want to find out which plans they participate in. I tell people to ask their doctor, do you take original Medicare? 93% of physicians will tell you yes. And if they say that, then you're in great shape. You can buy any Medigap plan you want, and your doctor will take it just fine. But if you were one of those people that was thinking you want to buy one of those zero premium HMO or PPO plans, and you don't ask your doctor if he participates in those networks, you might sign up for a plan and then find out after you signed up that your doctor doesn't participate in that one. So this is one of the things that a broker like Boomer Benefits can help you with, is checking the directories, making sure your doctors are in the network, making sure the drugs you take that are on the formulary. And, of course, that will make the whole thing easier for you because you may not know all the right questions to ask. But in the book, we give you the exact questions to ask the doctor. So that's a great little list to go down and ask your doctor those questions so that you make sure that you don't join a plan where the doctor is not in the network.
Oh, that's awesome.
Yeah, try to make it easy for people. And finally, failing to review your coverage. And you know what? We should all do this, right? I just got a letter in the mail the other day about my annual homeowner's insurance renewal. And I have to tell you, it's such a pain in the butt to shop that sometimes I just pay the increase and I don't always shop the insurance. But I know that when I finally do get around to doing it and I save a few $100s, I always think, wow, why didn't I do this sooner? Well, it's the same with health insurance. Your coverage changes from year to year. With Medicare, the deductibles go up. The drug plans change their formularies. The Advantage plans may have network changes. And so every year in the fall, in September, you'll get a letter from your insurance company telling you what's changing on your plan for the following year. And it's a good practice just to sit down and review that coverage and make sure that you understand what's changing and that you're comfortable with it. And if you aren't, that's when you can use that open enrollment period in the fall to make a plan change. And so I guess kind of the moral of the story here is kind of for the whole thing is just you got to do your research, right? You need to spend some time on this. It's not something that you ever want to just wing it because there's a lot of moving parts and you can make a mistake really easily. And so we put together a book to try to help all those people out there with those specific mistakes. And that's really just the mission of our agency, is to educate people. And we hope that by doing that there's going to be thousands of people across America that are going to keep money in their pockets instead of putting them into penalties and insurance company pockets. And that's what we're trying to do for folks.
Very cool. That's amazing. Awesome. I learned a lot. And things that, why would I have to know that? But now I do understand why I have to know that. So thank you so much for writing the book.
You're so welcome.
Not only that, but I mean, just being the one that's educating people. So one final question before we close the show. So after knowing all that, we always hear about Medicare for all, or is it Medicaid for all? So I believe it's Medicare for all. I don't know.
Mm-hmm.
But so what would be, I guess, like what's wrong with having that Medicare for all?
So in my opinion, if they kept Medicare the same way that it is now and we offered that to everyone, it would actually be great, because most people, once they get on Medicare and they understand how their coverage works and they've made their plan selections, they're good. You know, they get used to using their coverage and they're actually really satisfied with it. It's very full coverage. We don't have people that get on Medicare and hate it very often. So if they offered it like that, I would be totally in support of it. But the term Medicare for all is a misnomer, because what the politicians who talk about this mean, and Medicare for all was a phrase coined by Bernie Sanders. What he's talking about is single payer. It's a public option where nobody pays anything. All the coverage is delivered to you for free. And that sounds great in a lovely world, but as a nation, we can barely afford the way Medicare is now for 60 million people. They're paying premium, the beneficiaries, the members themselves, they're paying premiums for Part B, they're paying premiums for Part D. The coverage doesn't cover everything. It's only covering 80%. And so how could we go from that with 60 million people to overnight providing coverage at 100% for free for 300 million people? Well, the answer to that is, of course, higher taxes. And so, you know, some people may be in support of that and they think, hey, I'm willing to pay some higher taxes to have health care like that. But we know that Medicare Part A, you know, it's already going to be insolvent in 2026 unless Congress makes some changes. And so to me, I just look at it and think, how could we possibly keep the same quality of care that we have with Medicare today if everybody tomorrow stops paying into it and everyone gets everything for free? That's going to be a pretty big tax increase, and it makes me worried that the doctors wouldn't get paid the way that they need to deliver the quality of care that we have today. So I would love it if Congress would figure out how to make the same Medicare program we have today available for everyone, but people are going to pay into it like we do now, and that keeps the coverage in a quality level above the type of coverage that you can get somewhere in a nation like Canada or the UK, where there's sometimes waiting periods for health insurance. So that's my 2 cents on Medicare for all. It'll be really interesting to see what happens after the election.
For sure. Well, Danielle, this has absolutely been a fantastic episode. I mean, I've learned a lot. I got some notes. I tagged my mom in some Facebook posts. So, hopefully she kind of weighs in and, because I know that she deals with stuff like this with her home health care businesses and things like that. So I applaud you for writing something that is so niched, right? I mean, it is so just in there to a specific need in the marketplace, and I'm sure that so many people have been so grateful for that.
Thank you, Sean.
So as we close, where do you want the listeners to go? Do you want them to go to Boomer Benefits? Do you want them to go somewhere else? Like, where do you want the listeners to go after the show?
Yeah, if there's anyone out there who's learning about Medicare, the Boomer Benefits website at boomerbenefits.com is a great place to start. There's tons of free content on there. You can sign up to watch a webinar that's a Medicare 101. We also have a free email course, so if you prefer to get 6 videos over 6 days that teach you a little bit each day, we have that option available. And so all that content on there is free to you, and it's a great place to get started with learning everything you need to know about Medicare, if that's on your horizon here in the next few years.
Perfect. Awesome. Again, Danielle, thank you so much for coming on the show. And like I suspected, you are an absolute rock star, and there's so much amazing information that you've given to the listeners that hopefully they take it and they run with it. They go get your book, 10 Costly Medicare Mistakes You Can't Afford to Make.
Thank you, and thanks for all the good work you're doing out there in the world, Sean.
Oh, thank you so much. Life Transformation Radio listeners, an amazing guest impacting the world around her. If anything's resonated with our conversation today with Danielle Roberts, if you have any questions about Medicare, if you're going to be 65 this year, next year, the year after, don't wait. Connect with her. Go to boomerbenefits.com. Look at the Facebook, YouTube, and LinkedIn links in the show notes. There's so much amazing information that she gave out today. Go get her book. A grandchild, a child, buy it, give it to your grandparents, give it to your parents, give it to your aunts and uncles. Get people educated on this thing. This is serious stuff. So with that, thank you for listening to the show. Make sure you subscribe on your favorite podcast platform to Life Transformation Radio. And I close the show by saying, live your brand. Find opportunities every day to live out the core values that you hold deep in your heart. And I call this living your brand. So until next episode, live a great life.